Hi, I'm Dr. Dennis Lenslick. I'd like to spend a few moments with you and talk about temporomandibular joint pain, or TMJ pain. It's a very common problem that we'll see in a lot of people, especially women. The rate of TMJ pain in women is about 3 to 5 to 1 over men. The problem is that it doesn't show up as TMJ pain. It masks itself. It'll show up as chronic headache problems, pressure in the face, neck problems. And it's very subtle to detect. Medications typically don't help it. It's really a mechanical problem. And here's the issue. Your jaw swings open on its own very easily by gravity. To close the jaw, though, is a whole nother ballgame. So when you're opening and closing your jaw, the muscles have to do 80 to 90% of the work to close. And if they don't pull evenly, the jaw will deviate. It'll shift to one side versus the other side. Sometimes you'll feel or hear a lot of clicking in and around the ear, and you can have very strong pain right in here, or sometimes no pain at all. But what you'll find is that the person can't sleep good at night. They may have grinding of the teeth and other problems. But if we take a closer look at the neck here, here's what we'll find out. All the jaw muscles in here get their attachment off the top 4 or 5 vertebrae or bones in the cervical spine. So in any kind of jaw problem, the shape of the curve of the neck is always vitally important to what's going to happen to the jaw. If that curve is lost through an old car accident or a trauma of some sort, or chronic posture where the head is more forward and looks down, that's going to have a direct influence on what happens to the jaw joint. So when you address jaw problems, you just can't focus on the jaw alone. You have to take the jaw in relationship to how it relates to the cervical alignment of the spine and also what's going on with the head. The bones in the skull expand and contract about 8 to 12 times every minute with your breathing. And these joints in here, although very subtle, do move. And if they get locked up, that can also cause extra tension in the jaw area. So as a chiropractor, I'm looking at many different things to see why you're having the jaw pain. A lot of times we have to go in and do muscle work and therapy on the muscles themselves, correct neck misalignments, do acupuncture, laser, even sometimes adjust the shoulders, because all the muscle tissue on the shoulders and upper back will have a direct feed-in or referral of pain to the neck and shoulders and jaw themselves. So there's a lot of things that can go into a seemingly simple problem. So when you look at a TMJ problem, you got to look at a lot more than just the jaw joint.